Hi, this is Christine Vogel, and I just want to thank you for joining me for the second part of the simulation workshop. Last week, we discussed effective simulations, pre-briefing, and facilitating according to the International Nursing Association of Clinical Simulation and Learning, or INACSL Standards of Best Practice. This week, we will be discussing debriefing at length because debriefing and simulation can be described as the heart of learning in simulation-based education, and it can be described according to Palaganas, Fay, and Simon as a powerful tool for improving individual and team performance. Ultimately, effective structured debriefing by trained facilitators is the key component in simulation-based education. So our objectives today are to describe the purpose and benefit of debriefing, to differentiate between feedback and debriefing, and to identify elements of effective debriefing. When we discussed what we would like our students to accomplish by the use of simulation last week, the consensus was that we would like to see an increase in critical thinking, clinical reasoning, clinical judgment, as well as comfort level and assertiveness. The evidence is clear that the development of all of these performance behaviors occurs during the reflective debriefing process. So let's talk a little bit more about what debriefing is. You can see on the left, we've got a simulation, and then on the right, the students are putting the pieces together. The definition of debriefing, according to the Society for Simulation in Healthcare, or SSH, is a formal, collaborative, reflective process. And this occurs following the simulation for the purpose of moving toward assimilation and accommodation of learning to future situations. That definition is according to the SSH. There is a dictionary that is available online. I just want to mention that debriefing is different from feedback. Feedback is unidirectional. Debriefing is bidirectional or multidirectional, and that debriefing can include feedback from the instructor and the students in the simulation group. But remember, debriefing is not solely feedback. We do provide some feedback in debriefing, but that is not the purpose of debriefing. When we debrief, we use a learner-centered approach, which is different than the traditional teaching approach. We want to foster high participant engagement and to increase the transfer of new or reinforced knowledge, skills, and attitudes. And those can be transferred into the clinical setting. There are criteria for effective debriefing, and we will talk about 5 of those today. Debriefing, first of all, needs to be facilitated by an instructor or a content expert who is trained in the process of debriefing. So that's what we're working on today. And who is this debriefer? This debriefer needs to be competent in structured debriefing techniques. Instructors, clinical instructors, and subject matter experts leading the debriefing can maximize the opportunities arising from simulation. So today we'll be working on this training, and I'll also be providing you with the resources that I have found most helpful, as we are all still learning in this process. It's a process, and that means it's a journey, and every simulation group is different. The second criteria is that debriefing must be conducted in an environment conducive to learning. So that means we need to foster that trust, confidentiality, and reflective nature. Debriefing should occur away from the bedside, where emotions might be high from the simulation. And ideally, debriefing should occur in a separate room. The third criteria is that debriefing should be facilitated by someone who can devote enough concentrated attention to the simulation. So the person who's operating the technology, being the voice of the patient, acting as the doctor, filling out evaluations, and all of those other things that are occurring during the simulation, that person does not have enough dedicated attention to the simulation to debrief effectively. This is why you typically see at least 2 facilitators for simulations. The fourth criteria is that debriefing should be based on a theoretical framework and structured purposefully. So there are multiple debriefing frameworks, and the use of one or a blend of more than one framework helps to achieve the benefits of debriefing. These frameworks, and you might have heard of some of them, they include gather, analyze, and summarize. Another one is debriefing with good judgment. Another one is Debriefing for Meaningful Learning by Christina Dreyfus. I actually got to see her at a conference. She has some great information in her literature. The plus delta method, where the students or the facilitator basically put a line down the middle of the page of paper and list things that are going well, the plus things, the things that the students are doing well in the simulation. And delta is on the other side, where those are things that we might want to change, improve. So plus delta is a very great tool for beginners. And another framework is the Promoting Excellence and Reflective Learning in Simulation, or PEARLS. And this particular debriefing framework is used by Orlando Health. The last criteria for effective debriefing is that it must be congruent with the outcomes and objectives of the simulation. We talked a good deal about those outcomes and objectives last week during the first part of the training, and debriefing needs to follow the outcomes and objectives of the simulation as well. So there's quite a bit of criteria for effective debriefing. I think everyone can debrief. We just want to maximize those opportunities and be as effective as we can be for the students so that they can meet those outcomes and objectives and develop those behaviors that we want to see. So having said this, I just want to ask, does debriefing need to be perfect? So we have Snow White here, and she's got the birds landing on her shoulders and everything goes right for her. But no, debriefing doesn't necessarily need to be perfect. So I want you to take that pressure off right now. Just like effective simulation does not require perfection, it requires planning. Debriefing is the same way. It does not require perfection, but it does require planning and use of purposeful and structured debriefing techniques. So I want you to take that pressure off. Sometimes the debriefing is one of the things that faculty can be a little bit stressed about in formulating those effective questions. So we're going to go through some of the ideas that we have and some of the tools that are pretty helpful in that way. So there's Snow White. I know we have a couple Disney lovers. And so for those Disney lovers, again, I've got Doc and Happy here as well. And I just want to tell you, these are our students. This is what we want for our students. With planning and purposeful, structured debriefing techniques, our students can walk away from the debriefing with increased knowledge, skills, attitudes, critical thinking, clinical reasoning, and clinical judgment skills, as well as increased confidence and assertiveness. Those occur, all of this can be developed in the debriefing process. The simulation is a wonderful process, most certainly, but we need to take into consideration that that debriefing is where those behaviors occur.